about our mental health today, Alex.
Yes, so starting tomorrow, you can dial 988 at any time, anywhere, if you or someone you love is in emotional distress to the point of contemplating suicide.
Yeah, think of it, I guess, as 911 for your mental health, right? So, as you know, the death by suicide rates are quite high right now in the United States. So this is just something new because and
there's been a lifeline, but it's like 11 digits, it's a long number, and that's usually what we put up. And they get so many calls, more than 20 million calls from people looking for support. So now they just want to make it a little easier. Yeah,
and in fact, as many times we've done that story, right now, at the top of my head, I can't remember what the old 800 number was. Is that
there it is, because it's so long.
So now it's so easy.
This is memorable. So I'm going to bring in Dr. Ayla Stanford, Regional Director of Health Human Services, joining us this morning. So is that the reason why we're putting 988 out there, so it's easier for people to get help they need?
Absolutely. It's 3 digits.
Yep.
The 8 is right next to the 9. If English is a second language, it's easier. For folks with disabilities, it's easier. And it's more that we heard the cry for help, and this is a response. So yes, it's easy, but it also recognizes that, as you mentioned, mental health is increasing in our country, that 1 person dies from suicide every 11 minutes. And this is Health and Human Services and many other organizations saying, we hear you, and this is going to make it easier for you to get that help and the resources.
It's interesting. I'm glad you answered that, because I was wondering, how did they choose 88? It's far away from the 1, so you're not going to do the 911.
That is correct.
And the psychology of picking those numbers.
But it's all the same services as the Lifeline previously?
It's all the same services, and that previous Lifeline will still be active. So granted, the launch is tomorrow, but 911 took literally 50 years for it to really be operational.
So true.
And there is a backup for that 988 call that it will be routed and such. And so, yes.
Okay, tomorrow. Would it like it start at midnight or something like that? Or?
Yes.
Oh, okay.
Yes.
Okay.
And again, the original hotline will be available. And what's so important about Philadelphia is it's being launched, and everyone is hearing about it nationally, starting right here in Philly, because Philly has some of the best response rates for mobile crisis and for answering the crisis and suicide hotlines.
I didn't realize that.
Yes, and it's so magnificent that it has garnered, of course, Mayor Kenny will be here and is supporting the efforts. Secretary Becerra will be here in our city. SAMHSA, which is the Substance Abuse and Mental Health leaders, will be here. The Federal Communications Commission, and also our Veterans Administration.
Not in D.C. today.
Not in D.C.
Right here in Philly.
All happening. Good things do happen in Philadelphia.
Thank you, Doctor.
Launches happen in Philadelphia, and it will be here. We'll have a press conference, and the nation will see what HHS is doing for the mental health crisis.
And like we mentioned earlier, it's not just if you yourself, if you have a loved one too, because what's the process to remind folks? Is it a counselor that's on the other line?
Excellent question. So there are 3 ways. So number 1, you can call 988. When you get 988, it may be a prompt for English or Spanish. It will be a prompt for English or Spanish. Number 2, you can text 988. There'll be a survey to ask about what the immediate issue is, and you can also chat 988lifeline.org, and you can put in information. And in Philadelphia, at places like the consortium, they will send out a mobile crisis unit if something needs to happen immediately, and send a van to you to get the help to hopefully prevent that suicide from happening.
This is so much better than just that 800 number. I didn't realize you could text.
Yes.
Because some people don't want to talk. You know, that's a good.
And I mean, and that is honestly Health and Human Services recognizing, and the Federal Communications Commission saying we need to incorporate text messaging.
Before you go, I suppose we should talk about COVID a little bit, but also I want to talk about the headline that we saw yesterday about monkeypox is almost out of control in New York City, and that's only 99 miles away.
And the fact that people are having trouble getting access to vaccines.
Yes.
So what I can say say, and every region is different. There are 10 regions across the United States. We are Region 3. If you have any issues, we work very closely with the Philadelphia Department of Public Health. You can reach out to Region 3. We have already been advocating. The state of Pennsylvania has sent monkeypox vaccine to the health department.
Yeah.
And if you have any trouble, please reach out to us so we can help
I
you
think we
get
got
the resources.
about 250 doses just a couple days ago for
Just
Philly.
a couple days ago, but I can tell you over 4th of July weekend, our office advocated for there to be thousands of doses
Oh,
sent.
my.
So yes,
Ahead of the curve here.
a little bit.
Got to be careful. So this afternoon?
This after,
What time?
So it will be live streamed actually on all the HHS networks, 10 a.m. With Secretary Becerra and the other officials that we mentioned. There'll be a press conference following that at 5601 Chestnut Street with the backdrop of the beautiful mental and behavioral health mural by our mural arts program,
Yep.
also showcasing Philadelphia.
That is a great mural.
It is a beautiful
56th
mural.
in
Yes.
Chestnut.
And 988 is it's hope and it's help. It's easier, but it's also just recognizing that Health and Human Services knows that mental health, especially exacerbated by COVID, is real in our country.
Doctor, thank you for what you do for Philly,
you.
but also for the nation now.
Yeah. Thank you
Thank
so
you.
much.
you. Have a
Thank you
good
for
weekend.
having me.
All right.
Thank you for coming
I like that blue on you.
It's beautiful. And there you go. There you have the two numbers. So starting tomorrow, 988.